pressure on now. I better not go over my 15 minutes or I'm going to be in big trouble, so I'll move very, very fast indeed. Thank you very much for the opportunity to speak here, because a lot of people wonder why the fire service sometimes come to these things. Well, you put out fires. Where is that link? What is the involvement? Hopefully, that's less and less the case as people realise the link between fire and the risks we face. But I do applaud you for the opportunity to come here and speak. And I hope that what I'll be able to do is talk about the steps that the fire service are taking. And we are beginners, and these are baby steps that we are taking. But I hope this is the opportunity to share those steps with you, and maybe we can identify how we can work better in partnership. And I do know that a few of you, a few faces from various forums have been on. One thing I did want to also stress is that the fire service have signed the Aging Well City Pledge. We work with the Value and Older People team at Public Health Manchester, and I certainly think that is a link that needs to be explored, because I know that dementia isn't just about age, but it is another partner that we can involve. Is there anyone here from the Value and Older People team? Brilliant. So really glad to see you here, because I think there's a lot of crossover between us. Right, I'm going to the next. Here we go, that's it. Those are the three main things that we need help with. We can share some of the support we can offer, but we need help. And the fact of the matter is that in the same way that the police aren't always aware of what the risks to people are and what the symptoms are, we need help with that. So that is an area that we're exploring at the moment, and I'm very pleased to see Alba here, because we'll explain some of the links that we're getting about increasing our level of knowledge that our staff have to recognise the symptoms and signpost people properly, so that there's more effective development. I'd like to talk about how developing awareness of safety and hazard spotting. What are the links between fire and older people and other risks? Because if you can understand that, then the chances are that the referral route will be much, much more successful. And I'd like you to just have an overview of the home safety check process. And I know people like Karen across there are very well aware of what that is. We work very closely over the years with care and repair and other providers. Northwoods Housing, I saw someone was from Northwoods. Yeah. So I'm aware that some of you already know about this, but it's about getting it across that partnership. Unfortunately, you're not going to get the video because it takes too long. But those are some interesting information there if you want to have a look at them. 60% of people who died in fires in Greater Manchester between 2000 and 2011 were over 60. That's why the fire service is interested in forming partnerships, not just with people with dementia, because obviously there are multiple risks, but this is an area where we should be looking at, we should be working out, are the symptoms there? Can we forecast where these incidents will happen? Too often we are at the other end of it, where we're picking up the pieces and it's dealing with a coroner. My job is to get us in a much, much earlier stage. We need to get our interventions in there early, and we need to be working with the right people. And again, Alba hopefully will reinforce that some of the work we've done there is working with GPs, working with district nurses, working with Alzheimer's specialists in this and other areas, obviously. And we need to look at the person and how their cognitive impairment impacts on their day-to-day living. And that is where we need development, that's where we need training. So a few more figures, and I don't mean this to get too stats bound, but between 2007 and 2011, 50 out of 87 fatalities were caused by accidental fire. And we already know that 60% of our fatalities were people over the age of 60. We need to examine those. We need to find out who those people are and why they're at risk. Many of the cases, we think they can be prevented. But if we don't know about them, if we haven't worked hard at establishing partnerships, I'm afraid we're going to have to repeat the same old things time after time after time. And that's in nobody's interests. The way we do it, we've done what used to be called home fire risk assessments. Some of you will be aware of those. We've now broadened it to include other things because we want our staff to identify other threats, because there's lots of issues when you go into a home. We've got to lift our vision and see opportunities, because the risk isn't just about older people and people with dementia. There are lots of other things. So the prevention work will continue through home safety checks and with my prevention team, who've only been going a year, still learning, but I think it's a real step forward. I'll just go through these. I don't need to talk my way through these, but when I talked about layers of risk, these are the ones that the fire service know. It will come as no great surprise to any of you. So it's not just a matter of age, it's a matter of those layers. If you've got somebody who's over the age of 60, who's a smoker, who may have mobility issues, that risk is increasing. And the fire service need to know, because we can put interventions in there at an early stage. We can maybe stop that catastrophe happening at the other end. Certainly we can lend a hand. And the fact is, we can't stop everything, but we've got to get better at being ahead of the game and putting help in, putting interventions in that really matter. And I think some of you will recognise all of those things: living alone, isolation, and again, that's why working with the Valuing Older People's team at Manchester Public Health has been critical, because it's all about breaking down those barriers and also bridging generation gaps, getting people to help each other, which is another thing I think we've discussed before. All of those things we can be part of. We can't do it ourselves, but we can be part of. Okay, I think you've seen enough of that. Here we go. So I'm not talking about fatalities now, but I think for interest's sake, it's worth knowing that smoking is the number one cause for the fire service coming out. Not the number one cause for fatalities, but if you look through the same incident log that Ian was talking about, that's what you'll see time after time after time. Cigarettes. The last, we had a fatality in Manchester, a very elderly woman smoking, no smoke alarm. And it is avoidable, it is preventable. We need to explore why we weren't involved at the right place and at the right time. And all the other things we know. But if you combine all of those things, really the fire service should be aware and should be involved and should be helping. Again, almost 30% are already known to social services, but frequently we don't know until it's too late. So that's a pretty sad state of affairs. And I agree with Ian, it's about sharing information and not hiding it. I'd rather be out telling the coroner why I've shared a bit of information inappropriately than it's costing someone's life. Right, so we're trying to reach people from different angles. We need you more than you need us, I suppose. And I need to tap into your expertise. I need you to understand how you engage with the fire service, who you speak to, how it gets done, how it all happens. So that's really very much what it's about. Needless to say, this is about reducing risk. Everything we do is based on risk. We've identified that this is a good forum to meet people who have got something in common about identifying people who are at risk and need help and need support. In simple terms, those of you who don't know about home safety checks, that's what you'll get. Hazard spotting and prevention advice, And that will include sometimes lifting their vision. And it was interesting when Ian said about that case about the putting the cameras in and everything. About 6 months ago, we had a referral. A partner agency referred us. Thank God for that. It's somebody who was isolated, living alone, rented accommodation, and she was paying for care. The community safety advisor from the fire service went in, did the necessary, did all those things. She wasn't suffering from dementia particularly, but forgetful maybe a symptom that we should be picking up on. Explored it a little more, and what we found out was that the carer was taking an additional £35 a week. You know, the care was already paid for. It was an additional sum. She wasn't bothered, but the fact was, we should be, shouldn't we? Who was looking after the interests of that person? We could have missed that opportunity. If somebody hadn't referred that person to us and made them safer, and also if we hadn't gone and spent a bit of time and realised that this isn't quite right, and then we tied into other services, and obviously that care package was removed and the individuals were dealt with by, I think, trading standards, I think I'm right in thinking. So I think it's perhaps a good example of how that home safety check can not only do those things, but can add to the support that we offer people. I think I've done that one. And what is it? We fit smoke alarms for free, we check existing alarms, we give advice on maintenance, and we will also signpost. So in the same way that the police do, we will signpost essential services in a very, very similar manner. So it is all about that jigsaw, isn't it? That's the way I see it. And those are the benefits that I see. In particular with dementia, I think we've got there is joint visits work. The work we've done with Pam Keogh with the GP's Dementia Project in North Manchester. It's so much easier when you've got somebody who knows their stuff about dementia, about how the symptoms are going to show themselves, who can deliver training and can do joint work with us. It makes our life easier, it makes life for the client far more easier because it's something that they know about, they're aware about. And we can tailor our home safety check for that individual. And we increase our understanding and awareness. Right, to finish off, just to tell you what that team is, I've got 9 community safety advisors. They work right across the city of Manchester. If you're from outside of Manchester, there are similar arrangements in Salford and Trafford, Bury, Rochdale and Oldham, Stockport and Tameside, and Bolton and Wigan. So even if you sit outside the boundaries, remember there is a similar setup across all of those that the fire service need to know. A volunteer coordinator as well, which is again something that's worth knowing about. Those are the stations in Manchester, 7 stations, and remember they've all got community rooms where people like yourselves, if you need a free bit of space, free office,